Welcome back to the Operators. I'm joined today by Dr. Angela Mazza, founder and medical director of Metabolic Center for Wellness in Oviedo, Florida. Dr. Mazza is a triple board certified integrative endocrinologist who's built something pretty unique in Central Florida. She's the only physician in the region performing radiofrequency ablation for thyroid nodules, which is a procedure that can save people from surgery. She's been running her practice for over 11 years now, and I wanted to talk to her about what it actually takes to build and operate a specialty integrative practice from the ground up. Dr. Angela, welcome, and thank you for joining us.
Oh, thank you so much for inviting me. I appreciate it.
Let's start with the beginning. What first drew you to medicine and specifically to endocrinology?
Well, gosh, I was always, as a kid, just into science, and medicine was always the one thing that I wanted to do. As far as endocrinology, diabetes actually runs in my family. So I was always interested in diabetes. So that was something from the very start I was interested in. Now, when you go into medical school and you do like your clinical rotations, everything, you find out what you really don't like. So that kind of solidified endocrinology as a choice for me. Plus, I like the idea of hormones, and it's kind of very esoteric, but hormones affect everything and every single reaction that's going on in our body. So hormones are pretty important.
Absolutely. And the whole thing around diabetes running in the family, like I have a very similar situation where my father has diabetes, my grandma has diabetes, and I'm at a risk of that as well.
Right.
Never had to see an endocrinologist yet, thank God, knock on wood. Trying to keep a healthy lifestyle, but definitely something in the cards for me as well.
But definitely, if you know something's a risk factor for yourself, you want to do everything to avoid it. So,
And was there a moment, maybe a patient or a case, where you knew thyroid and hormones were going to be your focus?
probably not one case in particular. As far as thyroid, it was probably a series of cases over time once I started actually practicing in the real world that I knew that thyroid was my passion. Because when I out of fellowship, I joined a hospital-based practice, and as I was the only one that did thyroid biopsies and thyroid ultrasound, so I got a lot of the thyroid patients. So I realized as I was caring for those patients that we were not really treating them as appropriately as we could, and we weren't optimizing their care, and we were missing a lot of cases of patients with undiagnosed thyroid issues. So that's kind of how I got into my passion for thyroid.
Got it. And you're a doctor of osteopathy rather than an MD, and you've built your practice around this integrative whole person philosophy. How did that approach develop for you?
Well, I went into osteopathic medicine because I was very much interested in whole body wellness because you really can't treat one system without looking at the whole body. And integrative medicine kind of takes osteopathic medicine to that next level because integrative medicine really looks at getting to the root cause. And really, it identifies the fact that we have to look on at the cellular level to treat the whole body. And really, to care for a person in in wellness and longevity, you can't look at systems as silos. You have to look at them as integrative networks. Otherwise, you're not going to really get to the problem. You're just going to put Band-Aid on an issue rather than really getting to the issue at hand.
Absolutely. And you went through residency at Mercy Catholic,
hmm
fellowship at St. Louis University. What made you decide to go out on your own and start Metabolic Center for Wellness back in 2015?
well, that's actually a great question because that's kind of how I got into the caring for thyroid patients because I realized, you know what, in a hospital-based practice, I'm not going to be able to make the decisions that I want to make for best patient care because I realized I wasn't treating my patients to their best interests because I was kind of, I don't want to say handcuffed, but I was kind of stuck into the restrictions of a hospital-based practice. I wasn't happy, my patients weren't happy. So as I got more and more into integrative medicine, we decided let's just build our own clinic that we can treat our patients the best way possible. And that's how Metabolic Center for Wellness came into existence. And from that point on, uh, I really look to care for my patients kind of a teamwork approach, but really looking at whole body wellness, hormone health. And thyroid is a huge focus of our practice because thyroid influences pretty much every aspect of our being, from autoimmune thyroid issues, thyroid nodules, as you mentioned, the RFA. And our practice has really evolved over that time period.
And with the integrative approach, meaning whole body, how does that process of maybe issue identification or diagnosis, how is that process of discovery different than, let's say, just me going to a walk-in clinic or me going to a specific hospital or seeing a specific specialist? How is looking at the body as a whole, how is that process different?
Well, it's very much different because say you go into you're being treated for high blood pressure.
Mhm.
So you just go to either urgent care or primary care or whatever. They give you a pill for blood pressure. But we don't really get to the reason why you're having high blood pressure. Are you dealing with underlying metabolic issues that are driving your blood pressure? Are you dealing with inflammation that's been undiagnosed? Are you dealing with inflammation associated with gut health, hormone health? So really, we have those extra level of functional testing and kind of that type of mindset when we're looking from an integrative scope rather than just putting a band-aid on the issue. Because unfortunately, what happens when we kind of just do that traditional mindset, we start adding more and more medicines, and they start causing more side effects, and they cause micronutrient deficiencies, and they cause other issues where we're just compounding the issue rather than getting to the real root cause at hand.
Got it. And mind giving me a snapshot of Metabolic Center for Wellness today? How big is your team and what does your typical patient population look like?
Yeah, we've kept the overhead pretty small and our practice pretty small. I am the only provider. My husband is actually our office manager. We have a couple medical assistants and a billing specialist. But that's kind of, and we have cybersecurity, of course. But that's kind of our team, and I try and keep the overhead low so we can kind of keep patient care at its optimum. I only see maybe 15 patients a day at most. We have been not taking new patients other than for the RFAs and thyroid biopsies for quite some time now, just so we could continue to care for our patients the best that we can. And it's quality of life on our end too. I mean, I don't I don't want to overdo anything, or I want to be my best self for my patients too. So by keeping a patient load smaller, I think it actually adds to um, happiness on both ends of the spectrum.
Absolutely. And you're able to have that kind of control over the process, being
Right.
a more so solo practitioner. And you specialize in autoimmune thyroid disease, thyroid nodules, thyroid cancer, and hormonal imbalances. Is there one condition that ends up dominating your caseload?
Probably autoimmune thyroid disease is epidemic. So the majority of my patients do have some form of autoimmune thyroid issues going on. So that's like Hashimoto thyroiditis, which is the main cause of hypothyroidism in the US. That's Graves' disease, which is hyperthyroidism. But autoimmune thyroid issues can also be linked to thyroid nodules and thyroid cancer. So probably if I had to pick one, that would be it.
And how do patients typically find you? Is it referrals or are people seeking you out specifically for procedures like RFA? Do you run any ads or how do they come to you?
Probably word of mouth is a big one. Our patients are super nice. We have really great Google reviews. So patients find us that way. Patients are very proactive, and they really rely upon things like that rather than just going to their insurance company and saying, okay, I'm looking for an endocrinologist. Especially when it comes to RFA, because a lot of the patients that come to me have been patients who've been recommended thyroid surgery. So um, they were looking at other options rather than just removing their thyroid, because then you're not really fixing the problem with the thyroid nodule. You're actually just changing one problem out for another, because then someone has to be on thyroid hormone replacement for the rest of their lives. So patients are really searching out options on their own right now.
Makes complete sense. And in your case, are you in a position where a lot of patients end up being on the wait list because there's a surge of patients looking for your service, or are you still accepting new patients?
Well, we're only taking new patients for the procedures right now, but we have had a wait list in the past. The wait list is a kind of a plus and minus because I feel like people are, if they're needing something, they really shouldn't have to wait that long. So that's kind of, I have a mixed thoughts on a wait list. So unfortunately, we try and accommodate as many patients as we can for the procedures and get them in as quickly as possible, especially when it comes to thyroid biopsies, because thyroid, we're dealing with the question if someone has thyroid cancer. So I hate for people to wait when it comes to that.
Absolutely. Walk me through a typical Tuesday at the practice. What does your day look like from the time you get in?
My day starts pretty early. The day before, we prepare for our patients coming up for the next couple of days, like going through labs. Being an endocrinologist, I rely very heavily on labs. So we want to make sure that patients who are supposed to have labs ahead of time, we have them in the system. Unfortunately, sometimes all the labs aren't complete, so we have to try and go into the lab system and get whatever it is back. So that kind of starts pretty early. I do a lot of writing and I do a lot of writing, so that tends to be early on in the day. And then our day starts. We start to see patients, just kind of answering phone calls, managing patient issues throughout the day, and meanwhile, taking care of the patients that are coming in. We tend to do about a couple thyroid biopsies a day, perhaps an RFA. So it's in preparation for those procedures too. And then at the end of the day, kind of following up on anything that hasn't been tied up, whether it's a patient concern, refills. Refills are nonstop. So even on my days off, I am doing refills, but
Mhm.
that's just part of the business.
And you mentioned that you do a lot of writing. Is that more so charting? Is it follow-ups? Is it documenting the physician-patient interaction?
It's kind of a combination. So it's documenting in the chart, but I do a lot of writing on my own. I do a lot of teaching, so it's writing for other reasons too. So whether it's journal publication or um, anything along those lines as well.
And going now more so into the operation side of things, running a specialty practice for 11 years, what's been the hardest part that most people wouldn't see from the outside?
Um, One of the hardest things I will tell you is we are a hybrid practice, meaning we take insurance, but we also have a yearly fee. So dealing with the insurance is probably one of the most frustrating parts of running a practice because I'll have colleagues that tell me, just stop taking insurance. Well, I feel like that's not fair to the patients who rely upon using their insurance. But even just say I want to get a medicine recommended medicine for my one of my patients. The medicine right now is GLP-1s. So GLP-1s are everywhere, and patients want to be on them, and they work for different reasons. But insurance companies do put a lot of stipulations and barriers from patients getting those medicines that they want. So we do spend a lot of time working with insurance, doing prior authorizations, doing appeal letters, and that's kind of behind the scenes stuff that patients don't understand. They go to the pharmacy and expect their medicine to be there. But if those all these steps aren't completed and the insurance denies the medicine, they don't blame their insurance, they blame the practice for not being able to get that for them. So that's one of the things that I think is probably one of the most frustrating parts of my day and my team's day on a whole.
Having to take insurance, um, are there a lot of denials and a lot of billing work that you have to do? I know you mentioned that you have someone on your team that deals specifically with billing.
Yeah, so we have to actually pay a billing service in order to get reimbursed from the insurance company. So that's part of the overhead that I don't think a lot of people un, don't understand because that's factored in if you're talking about running a practice. That's factored into our monthly fees, if you will. There are a lot of denials, so it does take a lot of time and a lot of effort on our billing specialists end. And it can be frustrating because again, patients don't understand that part. They don't understand, well, I pay my premium. Why is my insurance not covering this, or why are they denying it? So, and insurances are covering less and less things over time. They want more and more information and are covering less and less.
Absolutely. And between the billing bottlenecks, do you also experience any bottlenecks around documentation, for example, scribing or like patient engagement through the different communication channels, being like email, phone, SMS? Are those a concern at all for you operationally, or does the front desk staff have that fully handled? And scribing wise, like you're totally fine with documenting the amount that you need via EMR.
Good. That's a great question. So as far as documentation from my patient visit, that I don't have too much of an issue with. I know what needs to be in the note. I take notes while I'm talking to my patients. And the good thing about caring for patients for a long period of time, you kind of know them, so it's easier to write a note when you know the person who you're talking to.
Mhm,
As far as emails can be kind of a problem because we try to encourage patients not to write emails because they're not always secure systems um, that are at play. As far as the patient portal, we don't do a patient portal because
mhm,
it's only me who's going to be answering any issues. We try and address things at the time of the appointment or patient during patient hour or office hours. So that's not so much of an issue either, just
mhm.
because we've chosen to go that route. I know other practices have a patient portal. I can tell you, if I had a patient portal, I would be answering issues 24/7. So we try and manage patient expectations, but at the same time, do the best job we can for the patients.
Mhm. Is there like frequently asked questions on the website or some sort of like maybe within the patient portal they already have like a whole like maybe like a database or a library of frequently asked questions, or maybe you've looked into some sort of AI chatbot solution that um, helps with a bit of the feedback and is able to categorize maybe issues that patients have, or do they have to essentially call every time they have a problem?
That actually would be a great idea. I would know, I would be interested in learning how to implement that. Right now, it's if patients are either sending in an email or sending in leaving a message or calling and talking to calling and talk to the staff at this point in time. But
Mhm,
having something like an AI, I don't know. I guess it you would have to come up with a list of, like you said, frequently asked questions. Whether
mhm,
is this a refill request or is this, a question about a medication or side effect? But
mhm.
that would be a great way of implementing AI.
And in your case, like I guess diving more so into the AI and EMR conversation, like which EMR or PMS do you guys use right now?
We use NextGen.
And then have you guys, between all the interactions that you have, do you have some sort of like an AI scribe that documents that interaction?
No, we do not. We document it on our own.
Because top of mind for me, if it's like when it comes to building a frequently asked questions agent that is maybe able to triage or sort or recommend next steps or suggest next steps to the patient. Like for example, that is technically built into one of the AI agents that we have around the voice. We also have one of the higher tiers, like an AI agent that they can build into the website to essentially engage the patient, ask questions,
Mhm.
not just qualify, but like go through the list of different questions. If you have like the advantage of having multiple agents is the fact that if you have one agent collecting all the information around the patient physician interaction and it's stored in a HIPAA compliant, secure way, it's like, cool, now we have a library to access
Mhm.
to build that chatbot off of.
Gotcha. That makes sense. Yeah.
And between all the different tech that you use, like you mentioned next gen, what is your experience with next gen? Is it positive, negative, something in between?
Probably something in between. I mean, I've used other EMRs in the past when I was at the hospital. This one seems to be okay. It
Mhm.
seems to be okay from a, sending in refills sort of standpoint, integrating labs from a sort of standpoint. Our billing person seems to work well with NextGen.
Got it. And you're not using any AI at the moment within your practice, correct?
No, no.
Have you looked into using anything, or it's just that the bottlenecks that you have within your practice, it didn't seem like they really needed any kind of AI to help with it?
Not at this point in time, but I can see how it would be valuable as far as my concern would be you have patients used to working on a certain level and then changing how they are dealing with their interaction. I can see how that would be awesome from a large practice, but
Mhm.
definitely the opportunity hasn't arisen. Like if NextGen said, "Hey, we have this AI chatbot that could help with some of refill requests and things like that," I would be totally open to that.
100%. And I think one of the things that is stopping a lot of third-party tools, such as Caesar Health, from really spreading is the fact that uh, all different clinics use different kinds of EMRs, and
Right.
EMRs like to gatekeep information, and they're not
Yeah.
as open to developing APIs to make it available for other players to step in and essentially deliver a service for their clients that they could be offering instead, which results in very slow development from the EMR side for basic AI tools such as the scribe or such as the voice agent to manage the phone calls or manage the SMS, manage the emails, so on and so forth. And so a lot of EMRs prefer to develop it themselves. It's just it takes them a while longer
Longer.
than, let's say, a separate company that's more lean and mean in development.
Yeah, that makes complete sense. I mean, they do like to, because even if you wanted to change from one EMR to another, it's like a whole act of Congress to do that. I mean, it's a big, it's a big step.
And if you could wave a magic wand and have a tool that solved one specific problem in your practice, what would it do?
Hmm. Um, from a operation standpoint, it would be something that could manage prior authorizations and billing. I think that's I think that's our one of our biggest barriers in our practice.
Even with a billing service?
Yeah.
It sounds like quite a few of those claims end up getting denied, which probably creates a lot of headache for you guys.
Oh, yeah. And it makes the patients upset too.
At your scale, I wonder if an RCM AI solution exists that helps. Like ours is in beta.
Okay.
And so I have seen a few tools out there for RCM AI. I'm wondering whether or not it would make sense at your scale to look into them simply because the volume's just lower.
Right. Well, I would be definitely interested in looking into it.
Absolutely. Absolutely. And happy to have you chat with our CEO and founder, Shukri. Him being also the CTO, the guy behind the tech. Um, he would be, I think, the best one to speak on the RCM because I haven't had a chance to use it myself, but more than happy to share more on the other existing tools that we have, specifically around like the voice agent, the phone,
Yeah.
um, the SMS, the email, the documentation, the scribing. Those are some of the other agents that um, we often speak with doctors about.
Cool. I would love to hear more.
In terms of the Metabolic Center for Wellness, like what's next for you guys? Are you thinking about growth? Are you thinking about maybe scaling or bringing on additional physicians, additional providers, or what's next on the horizon?
I think at this point in time, probably not bring on another provider. We're hoping to just keep doing more and more of the procedures because I feel like that's kind of a not it's not available to a lot of people, especially the RFA. I feel like we're providing a service that patients need and they can't get it everywhere. So that's probably what we're going with. As far as growth otherwise, from a clinic standpoint, that's probably the biggest thing.
Nice. And if everything goes the way you're hoping over the next 2 or 3 years, what does your practice look like?
I think it's probably not going to be all that different. Um, Hopefully, it's just going to be a little bit more streamlined. Every year, we look to add one more thing in, whether it's a new functional test or a new IV or a new procedure, a new pellet therapy. So we do a lot of different things. So I like to kind of keep adding to the list of things we can offer to our patients.
And what advice would you give to another physician who's thinking about starting their own integrative or specialty practice?
Well, I would say to probably one of my best words of advice would be to keep things small, especially in the beginning. You don't want to overextend yourself or say you're offering too many things. So, like I said, we add things as we go. If you say we're going to do the offer the world as far as options for our patients, you're going to set yourself up for failure. You
Mhm.
don't want to overextend yourself. I think that's one of the biggest things with doctors who do virtuals, they don't have as much overhead to start with because, I mean, you know, you do need money to start out, and it takes a while to start seeing that money come back in. So keeping things on I mean, we're small scale, but keep it even smaller when you're starting out. And find colleagues that you can rely upon and ask questions. I when I do a lot of lecturing to other physicians, and that's one of the biggest things is we want to start our own practice, but where do we even start? So kind of ask people who've done it already, but keep things on a small scale.
Got it. And it actually reminds me, I'm currently out of Eastern Europe traveling a little bit, and I'm out of Riga, Latvia, which is a state in the Baltics that's right beside Russia. You never hear about it. Very niche place to be, but it used to be a big health hub in the
Okay.
USSR, and they have a few colleges slash universities here focused on health, and you would run into a lot of international medical students. And I remember meeting one gal that just finished her program that was thinking about specializing in endocrinology because she wanted to do something remote. Are there a lot of endocrinologists that do stuff remote, which now with the trend towards making things online, is that making that specialty very saturated in terms of specialists? Or would you say um, that there's still a lot of demand for more endocrinologists?
I think there's still a lot of demand for more endos. You know, Unfortunately, I'm one of the things I try and work on teaching is integrative endocrinology.
Mhm,
Unfortunately, the field of endocrinology tends to be stuck into like a traditional state, so it's going to
mhm.
be the traditional kind of practice. So, um, but I can't see there ever being an oversaturation of endocrinologists. So only because there's so many hormonal issues out there. And if you just look at diabetes, I mean, diabetes in of itself, yes, we want to decrease the risk of persons having diabetes, but there are so many people out there that need help with their diabetes to prevent complications, and they just don't have access to endocrinologists. So that's where having virtual care does help out because there's people in Middle America that they're like hours away from an endocrinologist. They don't have the access, and unfortunately, they suffer complications.
And one of the things that's been top of mind for us, I think sometime mid-December, this was just a few weeks ago, with the Trump administration announcing MAHA, Make America Healthy Again, movement, they announced big grants or I think up to 100 organizations, roughly, I think it's anywhere between 300 to 500 mil. And one of the big focuses of that grant was to target chronic diseases. And so something that's been top of mind for us at Caesar Health is how can we position ourselves to help more with um, chronic diseases such as diabetes, and position us in a way where we can take advantage of grants like that to continue development. Because something that's very interesting that I found out recently is that um, just understanding more about how insurance works, and it turns out that a very small percentage of people within companies that have chronic diseases end up actually costing like 50 or 60% of the bill for companies that end up paying premiums to insurers, which is very interesting. I never thought of it that way, but it turns out that chronic diseases, um, people with chronic diseases end up costing companies way more than an average person just in terms of insurance.
Right. It's from a cost standpoint, if you look at the numbers, it just makes sense to prevent things early on, like diabetes. And
And so
education is
there's
key. So that's, I think, a lot of this patient direct to direct to consumer kind of patient education is valuable. So I, if we can prevent someone from having a condition, that would be the optimal course.
and over time, have you seen kind of the trend in chronic diseases? Does it seem that more people today have chronic diseases than they did, let's say, like 5 or 10 years ago? Or has the trend sort of shifted since COVID with people being more health conscious? Have you seen kind of a downtrend in terms of chronic diseases, or is it still on the up?
Well, I'm kind of a biased viewpoint because I mainly see people with chronic diseases. So I would say it probably has leveled off. If we look at the rates of obesity, it depends upon what what graph you're looking at. Some say it's leveling off. Some say it's continuing to climb because chronic disease is gonna reflect whatever that obesity trend is. It's definitely not going down. So I think there are more people that are with direct to consumer kind of education are trying to be more healthy, but there's still just as many people who say, I don't want to know. And then they end up in the hospital and then that's kind of the horse is out of the gate by that time, you know? So there is kind of a almost a split, if you will. The people that are in denial are going to continue to be coming up with issues that they didn't know that they had. But there are more people that are interested in being healthy. So I would say chronic disease has at least stayed the same, if not maybe gotten a little bit higher.
Got it. And tracking that, we're pretty much at time here. Where can people find you, your practice, your podcast, your book? Where should folks go if they want to learn more about you or the practice or your specialty?
Oh, sure. So our website is metaboliccenterforwellness.com. Um, as you mentioned, I do have a book called Thyroid Talk. We also have a podcast called Thyroid Talk, where we discuss, yes, thyroid, but lots of other things. And I'm on Facebook, Instagram, and I have a YouTube channel. So I try and give good information that's easily accessible and easy to implement.
Nice. And what's the Instagram handle if they want to find you?
Um, at Metabolic Center for Wellness.
Perfect. Sounds awesome. Dr. Mazza, thank you for being so open about what it is that actually takes to run a practice like yours, and really enjoyed this conversation. Thank you for the insights.
Oh, thank you so much for having me, and thanks for kind of spreading this really good information out for other practitioners.
And for everyone listening, if you want to hear more conversations like this with the people actually running medical practices, check out the operators on whichever platform you get your podcasts. Cheers.